CEHAT, Center for Enquiry into Health and Allied Themes. Since its inception in 1994, CEHAT has influenced fundamental changes within the public health system through rigorous scientific research informed by ethics and democratic principles.
Health is actually what is called as an inalienable right. Unfortunately, that is not how health is really experienced by people in India, especially the marginalized communities. Health is not accessible equally to different people, and they may be discriminated on the basis of different aspects like age, class, caste, gender, sexual orientation, religion, ability and disability, and so on. CEHAT's entire effort is to make health accessible to all of these marginalized communities through grounded research and evidence building.
Center for Enquiry into Health and Allied Themes was established as the first institution of Anusandhan Trust. And a lot of strategic thinking went into it amongst us. 4 pillars which are foundations for any research by CEHAT are relevance of the research, social accountability, ethical standards, and democratic functioning. Before accepting any research project, we ask ourselves that will our research endeavor enhance the access of healthcare services for the marginalized sections of society? Will our research aid the people's organizations in their campaign for access to quality healthcare? Will it lead to better bargaining power of the masses and also regulation over the private market and providers? Will it suggest better health policy instruments for equitable distribution of healthcare services? Will it aid preventing violence and taking care of survivors?
So at CEHAT, we have 4 thematic areas. The first is about health services and financing. The second looks at health legislation and ethics. The third looks at gender and health. And the fourth looks at violence and health. And most of our research, intervention, advocacy and services are in these 4 thematic areas. We've carried out several studies in the theme of health services and financing, but the one study that comes to my mind is a landmark study that was conducted in 2005. We were looking at how the private sector in Maharashtra is actually having or not having standards of care for patients, and some of the study findings were actually quite shocking.
Of the 261 hospitals that CEHAT studied, 146 provided maternity services, and yet only 9 of them had a qualified midwife. Most claimed to provide emergency care, but only 3 had a blood bank and just 8 an ambulance.
Most shocking was also that despite these being maternity homes, they did not have round-the-clock resident doctor to actually oversee patients.
Apart from the need to regulate private healthcare, CEHAT's research also points to the need for better policy instruments for equitable distribution of healthcare.
Every year, around 55 million households are pushed below the poverty line because of the out-of-pocket expenditure. Citizens are forced to spend money from their own pocket when it comes to the healthcare.
The deepest inequities in the resourcing of public healthcare were most starkly highlighted by the COVID-19 pandemic. It reflected how inadequate our systems were to respond to a crisis of this magnitude.
Maharashtra was the epicenter of COVID pandemic. In Mumbai especially, it was the public health system and the BMC hospitals which were on a war footing responding to COVID. Yet every other day you had newspapers suggesting how BMC hospitals are falling short, they are not good enough. And we carried out a rapid survey to really assess the extent to which the BMC staffers felt prepared to respond to COVID, what were their own challenges. And you will be surprised to note that all kinds of good practices were being mentioned by staff from all quarters. People were staying round the clock in hospitals. They had not seen their families for months together. And that was the time that we really felt that the BMC hospitals were stretched and they were doing the best that they could.
The issue of domestic violence was taken up as the starting point of CEHAT's work to legitimize human rights issues within the public health system.
If you go to any public hospital in India, in emergency departments, you will often find assaults, accidental poisoning and attempted suicides and homicides, mostly reported by women. But these were never considered as domestic violence against them. Dilasa is India's first hospital-based crisis center, which was set up in 2000, 23 years ago. There is a team of counselors who are trained to provide feminist counseling services to survivors of violence. These could be children, it could be adolescents, these could be women, it could even be trans people or people in same-sex relationships.
The National Health Mission allocated funds to the tune of 93.67 lakh rupees to upscale the Dilasa model in 11 hospitals across Mumbai. The model is now being replicated in various states across India.
The experience gained from Dilasa and monitoring of its services made us realize that there is a need to develop an ethical framework to guide the delivery of the counseling services to survivors of violence. CEHAT developed a handbook to address this issue. These guidelines are now adopted by Government of India for operationalization of one-stop crisis centers across the country. We work with the healthcare providers to ensure equitable health and healthcare to everyone, but at the same time, we know and recognize that they also face violence from the patients and their relatives.
CEHAT conducted a study with resident doctors of public hospitals in Maharashtra to capture their experience of violence at the workplace. 62% of doctors who participated in the study had faced or witnessed violence by patients, their relatives, and escorts. 35% of doctors who were exposed to violence lost motivation to work, and 72% recommended training on communication skills for healthcare providers.
Building research evidence, advocacy, engagement with the government are the usual routes that CEHAT would take to ensure that health is a human right. But sometimes you also have to take resort to litigations.
In the year 2000, CEHAT, along with two other applicants, filed a PIL to review the PCPNDT Act. Another landmark PIL that CEHAT filed was against the government of Maharashtra's health department.
It's been a long battle with the government of Maharashtra to convince them to adopt gender-sensitive formats for rape examination and to recognize the rights of rape survivors. But finally, they have come around and they have accepted both aspects, right to healthcare for rape survivors as well as replacing the old archaic formats now with gender-sensitive protocols for rape care. So the role of the health sector is not just restricted to responding to violence against women. They're supposed to be responding to all forms of violence, and custodial torture and postmortems both are important responsibilities of the health professional, which is a doctor. We had to backtrack and look at the past records of persons in custody and the nature of medical examination that was carried out on them. And it was shocking to see that despite having so many injuries on their bodies, the medical opinion did not cite any of these. So I would say that was the driving force for CEHAT to really look at ways in which one can support doctors so that they can carry out objective examination of people who are in custody. Another connected issue is that to do with postmortems and postmortems for persons who are found dead in mysterious circumstances. So a consultative group of experts was put together to really look at mechanisms which are robust and that can enable doctors to be able to carry out postmortems in an objective manner and uphold human rights of people who are even not alive.
In the year 2014, CEHAT, in collaboration with the Directorate of Medical Education and Research Maharashtra and the Maharashtra University of Health Sciences, embarked on a project to integrate gender into the undergraduate medical curriculum.
So today what we are going to see, this is gender in health and medicine.
25 medical teachers from 7 medical colleges across Maharashtra, along with CEHAT, co-created this curriculum.
And from there on to almost 9 years later, the same teachers are the biggest advocates for the gender in medical education, and they are also mentoring the new generation of medical teachers.
CEHAT is now spearheading gender-sensitive medical education in additional medical colleges. as well as creating gender-equitable, sensitive services in 5 semi-urban and rural medical colleges. CEHAT has played an instrumental role in getting gender and medical education to be recognized by the Maharashtra government, and all government medical colleges across the state are expected to implement it.
Over the last 30 years, the socially relevant researches done by CEHAT have been exemplary throughout the country. They have been used even other developing countries in Asia, Africa, Latin America. And the new generation, those who were mentored by my generation of CEHAT professionals, they are carrying forward the same legacy.